Hey everyone, it's Dr. Mike. Right now I want to talk to you about a situation that needs our urgent attention: the devastating floods in Bangladesh. In August 2024, southeast and northwest Bangladesh were hit with severe floods, impacting millions. Beyond the immediate danger, there's a silent crisis brewing, a health crisis. We're talking about the spread of waterborne diseases, respiratory infections, and skin infections, especially affecting vulnerable populations like children and pregnant women. When floodwaters rise, they contaminate clean water sources, turning a vital life force into a breeding ground for deadly diseases. One of the biggest threats is cholera, an acute diarrheal infection that can lead to severe dehydration and death if not treated promptly. With limited access to clean water and sanitation, cholera can spread like wildfire. Typhoid fever, causing high fever and severe fatigue, and hepatitis A, which attacks the liver, are also major concerns. Dysentery causes severe diarrhea with blood and mucus, leaving people weak and dehydrated. Leptospirosis, a bacterial infection spread through the urine of infected animals, skyrockets with floodwater contamination. These waterborne illnesses pose a serious threat to those already grappling with the flood's devastation. Standing water creates the perfect breeding ground for disease-carrying mosquitoes. Malaria, causing high fever and flu-like symptoms, becomes a serious threat in flood-affected regions. Dengue fever causes debilitating muscle and joint pain and can lead to internal bleeding. Chikungunya causes severe joint pain, often mistaken for arthritis. The increase in mosquito breeding sites after a flood significantly raises the risk of these diseases spreading rapidly. Imagine being surrounded by dampness and moisture, your home filled with the musty smell of mold and mildew. This damp environment can quickly become a breeding ground for respiratory infections. Pneumonia, a serious lung infection, is a major concern in flood-affected areas. Acute respiratory infections, like the common cold and flu, spread more easily in crowded shelters. These might seem minor, but for people already weakened by the floods, they can be life-threatening. People with asthma are particularly vulnerable, as mold and mildew can trigger severe asthma attacks. The dampness and poor air quality exacerbate their condition, leading to life-threatening complications. When floodwaters recede, they leave behind a trail of destruction and contamination. For many people, this means battling a wave of skin infections. Fungal infections, like athlete's foot and ringworm, thrive in warm, moist environments. Cellulitis, a bacterial skin infection, causes redness, swelling, and pain. Floodwaters often carry bacteria that can enter the body through cuts and abrasions. Impetigo, a highly contagious bacterial skin infection, commonly affects children and spreads rapidly in flood-affected areas. Floods don't just wash away homes and livelihoods, they also wash away crops and disrupt food supplies. This disruption can lead to food scarcity and malnutrition, affecting children and pregnant women the most. Undernutrition weakens the immune system, making people more susceptible to infections. In children, it can lead to stunted growth and developmental delays. Pregnant women need adequate nutrition to support the growing fetus, and lack of it can lead to complications. The lack of access to diverse and nutritious food in flood-affected areas exacerbates the problem, leading to micronutrient deficiencies. The physical devastation of a flood is impossible to ignore, but the mental health toll it takes on individuals and communities is often overlooked. The trauma of losing loved ones, homes, and livelihoods can leave deep emotional scars. PTSD, a mental health condition triggered by a terrifying event, is common among flood survivors. Nightmares, flashbacks, anxiety, and emotional distress are debilitating symptoms. Anxiety and depression are also widespread in flood-affected communities. Providing psychological support and mental health services is essential to help them cope with the trauma and rebuild their lives. The floods in Bangladesh are a stark reminder of the interconnectedness of our world and the importance of global health. The health risks in the aftermath of a flood are immense, ranging from deadly waterborne diseases to the hidden crisis of mental health. But we can't just stand by and watch, we need to act. Implementing mitigation measures is crucial to protecting the health of flood-affected populations. This includes providing access to clean water, sanitation facilities, and essential healthcare services. We also need to prioritize disease prevention through vaccination campaigns, vector control measures, and public health education. Let's come together as a global community and stand with Bangladesh in their time of need.